RF Safe Protecting Public Health. Join us in advocating for safer technology. Update FCC safety guidelines. Embrace modern science. The Federal Communications Commission, FCC, continues to rely on outdated safety guidelines that were established in the 1990s. These guidelines only consider the thermal effects of radio frequency electromagnetic fields, RF-EMF, the heating of tissue when exposed to radiation. However, recent peer-reviewed studies have conclusively demonstrated that non-thermal biological effects, such as DNA damage, oxidative stress, and cellular dysfunction, pose significant health risks, particularly to vulnerable populations like children. Why this matters. 2021 court ruling. In a landmark lawsuit led by Environmental Health Trust, EHT, and Robert F. Kennedy Jr., the U.S. Court of Appeals for the D.C. Circuit ruled in August 2021 that the FCC failed to provide a reasoned explanation for its determination that its 1996 RF emission guidelines adequately protect against harmful effects of exposure to radio frequency radiation unrelated to cancer. This court decision underscores that the current standards are outdated and do not reflect the current understanding of health risks from non-thermal exposure. National Toxicology Program, NTP, findings. The NTP study, one of the largest and most comprehensive investigations into the health effects of RF-EMF, found clear evidence linking RF radiation to cancer, including malignant brain tumors, gliomas, and heart tumors, schwannomas, in animal studies. This landmark research raised significant concerns about the long-term safety of wireless devices, especially for children and pregnant women, vulnerable populations. Children are more susceptible to RF-EMF exposure because their skulls are thinner, allowing deeper penetration of radiation into the brain. Furthermore, their developing tissues are more sensitive to environmental toxins, and their longer lifetime exposure to RF radiation compounds the risks. Studies have shown that radiation penetrates deeper into children's brains, and they absorb more radiation compared to adults. Non-thermal effects. Numerous studies have shown that even low levels of RF radiation, below the thermal threshold, can lead to DNA strand breaks, induce oxidative stress, and disrupt the body's natural cellular repair mechanisms. These effects have been linked to conditions such as cancer, infertility, neurological disorders, and sleep disturbances. Non-thermal effects are not currently accounted for in the FCC's safety guidelines, leaving the public unprotected from the real risks posed by long-term exposure. We, the people, demand. The FCC must immediately update its safety guidelines to reflect current scientific understanding. This means incorporating both thermal and non-thermal effects to adequately protect public health. By enforcing stricter safety standards, the FCC will compel manufacturers to develop safer technologies, which is critical for the health of future generations. Restart National Toxicology Program, NTP, Cancer Research. Rats. There is a connection, NTP, Rhode Island, and human cancer morphology. The National Toxicology Program's NTP groundbreaking research on RF radiation was one of the most comprehensive efforts to date to understand the health impacts of long-term exposure to wireless technology. Despite its importance, concerns have arisen about the continuation of this critical research. Why this matters. National Toxicology Program and Ramazzini Institute findings. Both found clear evidence of carcinogenic effects from radiofrequency radiation, RFR, in animal studies, with increased tumor incidence in the brain and heart. Recent studies have linked these findings to human cancers through similar genetic mutations and tumor morphology. The importance of NTP studies. The NTP studies represent some of the most thorough investigations into the potential health effects of RF-EMF exposure, particularly its link to cancer. These studies included over 10 years of research and were designed to provide the kind of long-term data needed to inform global health and safety standards. Health policy impact. Halting NTP research would mean losing the opportunity to further investigate and confirm the risks posed by RF radiation. This research is crucial for creating effective public health policies, updating safety regulations and ensuring that future generations are not left unprotected from the potential harms of wireless technologies. Ending such research after finding evidence of harm is akin to discovering smoking causes cancer and then stopping all further research, which would be irresponsible. Therapeutic potential. While RF EMF poses risks, there is also potential for therapeutic uses, such as cancer treatment. Therabionic, a recent FDA-approved treatment, uses specific RF frequencies to treat liver cancer without thermal effects, showcasing the dual nature of RF EMF. Understanding how to minimize the risks while exploring these therapeutic applications is essential for future innovation in medicine. We, the people, demand. We call for the immediate continuation and support for the NTP's research. Without this critical work, we lack a full understanding of the health implications of RF EMF exposure, which is vital for crafting informed policy decisions. Continued research will also pave the way for safer technological advancements that protect public health. End FCC regulatory capture, prioritize public health over profits, advocating for comprehensive wireless radiation regulation. For decades, regulatory capture has allowed industry interests to exercise undue influence over the FCC, resulting in policies that favor corporate profits over public safety. Industry insiders within regulatory positions create conflicts of interest that prevent the FCC from acting in the best interest of public health. This has led to the unchecked proliferation of wireless technologies without adequate safety standards. Why this matters: industry influence and conflicts of interest. Tom Wheeler, former head of the CTIA, a major telecommunications lobbying group, was appointed as FCC chairman under the Obama administration. Wheeler's history of advocating for the wireless industry's interests raised serious concerns about the FCC's ability to regulate the industry impartially. Under his leadership, the FCC failed to update its radio frequency exposure guidelines, which remain based on science from the 1990s. Public trust and safety. The FCC's failure to act has eroded public trust in its ability to regulate the wireless industry effectively. Allowing industry lobbyists to drive policy decisions results in weaker safety regulations that do not protect the public from RF EMF exposure. The 2021 court ruling highlighted the FCC's inadequacy in considering non-thermal biological effects of RF radiation. Unchecked technology proliferation. Without stringent regulations, the rollout of new wireless technologies, including 5G and satellite-based internet networks, continues without sufficient safety testing. This leaves millions of Americans, including children, exposed to higher levels of radiation from a growing number of devices, towers, and networks. We, the people, demand. The FCC must implement measures to eliminate industry influence and ensure that public health and safety are the primary considerations in all regulatory decisions. This includes enforcing transparent, science-based policymaking and ensuring that future FCC leadership has no ties to the industries they are tasked with regulating. Only then can we rebuild public trust and protect future generations from unnecessary health risks. Visit RF Safe to learn more.